Hello everyone, I am back doing an update post-op vertical sleeve gastrectomy, and I am so happy that I am now 4 months post-op. 4 months to be precise. It's 4 months and 5 days, not a full week yet, but 4 months post-op. And I am so happy for one specific reason. I am still alive and down 75 pounds. So I am still alive and down 75 pounds. If you follow me, you know that I had a lot of challenges. And today I had a doctor's visit and I had to do some labs because I still struggle with gastrointestinal inflammation. And no, I do not have H. pylori, the bacteria that eats away the mucous membrane that causes the stomach acid to eat away the lining of the stomach that causes ulcers. I don't have that. So we don't know where the inflammation is coming from, and the inflammation is the whole GI tract. Like some people say, from the rooter to the tutor. So it's not only the stomach itself. But today, one of the challenges of only being able, because I'm still at the point where I can only tolerate 2 ounces of water every 15 minutes. Some people, I watch other people's videos, and some people said that they have no problems drinking at all. And I'm not there. I'm not. So when I went to do lab work for them to find out what is going on with my body, because lab work is usually done 6 months post-op, but since I've been having so many challenges, they suggested that I do it to find out what's going on, which is a good suggestion. So I have several, it just fell off. I have several sticks here, if you can see it, the gauze, and some swelling, and stick here, stick here, stick here. I was stuck here, but this one, they didn't put one on here either. So basically, my arms just been stuck up. Because when you're not able to drink a large amount of water, because anybody knows that when you do lab work, it's highly suggested for you to drink water so it's easier access for the veins. The veins are more engorged, easily visible, and hopefully easy to puncture. Right? But in my case, and everyone's situation is different. Some people that have weight loss surgery, they could probably drink they on their video they say have no problem drinking. But my stomach, the 2 ounces that my stomach is, listen, it can't. And I'm on my 3rd bottle now, and it's like around 12. I'm on my 3rd bottle right now, and I have about 8 ounces in here. So I have a good amount of water that I already drank this morning. I've been drinking to make sure I have enough water, because I already know I had to do lab work. So there are pros and cons, and I do my videos so people who are struggling with weight loss and are considering weight loss surgery can get the full story. And of course, if you want to ask extra stuff, you can add it in the comments and everything. But I still ask myself this question: would I still do the surgery if I knew I would have to go through all of this? And the answer is yes. It's yes. Because a person like me that has struggled with obesity since I was 8 years old, and now I'm 42 at this current time right now. Yes, I've tried a lot of things. A lot. Can't even number how many things. Yes. Seeing the scale getting lower and lower in weight, seeing the BMI going down, yes, I would. Going through all the stuff I went post-op, yes, I would. And oh yeah, I almost forgot this part before I finish this video. Yeah, so when I went to the doctor, my blood pressure was 80 something over 40 something, which they were kind of concerned about. Because that's low for an adult to have a blood pressure like that. And she's like, maybe you're very dehydrated, even though the minimum is 48 ounces, even though most of the time, majority of the days, like 5 out of 7 or 6 out of 7 days, I'm able to meet the minimum requirement. Every week my stomach inflames so much that I'm not able to meet those requirements for protein, because in order for me to when my stomach is so inflamed and swollen, and I have this full feeling that nothing could go in my stomach, and when I try to sip water, the water is trying to fly back up out of my mouth, I just try to make sure I take my vitamins and nibble on some food. I mean, like, sometimes it takes 3 hours to eat something small. Sometimes it's 1 ounce, and it takes 3 hours to eat it. But the rest of the days, I'm able to meet those 48 ounces. And I don't understand exactly why my blood pressure is that low. I know my sodium was low also. So, because I'm very sensitive to salt, very, very sensitive to salt. When I eat salt and there's too much for my specific body, my heart starts beating hard. I mean, it feels like my heart is jumping out of my chest. So I make my food a certain way. That's why even though at my heaviest, I did not have high blood pressure, because my body is extremely sensitive to salt. Extremely. So I try to put a little more salt in my food. If a person is used to eating out, because when you eat out a lot, your sodium tolerance is high, and you don't know how much salt is in something because you eat out so often. And some people just cook with a lot of salt. But I'm not one of those people, so I'm very, very sensitive. And when I go to restaurants, if I take that first bite and I feel it on my tongue, my heart immediately, no, can't eat it. So that's probably my sodium being low. And being able to meet the minimum requirement of water, but not enough for my specific body and size. Because before surgery, these Kirkland 16.9 ounce bottles, right now I can make it to maybe 3.5 bottles. Before surgery, I used to down 6 to 8 of these. So my body is used to a lot of water. And right now, my stomach is, no. My stomach is like, no. So that's one thing. And I use an app to track everything that goes into my mouth. Because I have a goal and I want to stick to it. And the app is called Barrytastic. It's a very, 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 very good app. Extremely good app. One of the issues I have with the app is how it shows fat consumption. So, for example, when I eat like 1 ounce of avocado, it doesn't differentiate between good fats and bad fats, right? So when I eat my salmon with my spinach and I eat my avocado, it just shows up as just fat. So when I go on my app, and I eat a good amount of fish. I mean, I steam fish, fresh fish. I bake salmon. So there, the fat content, even though it's good fat, when you look at it, you're looking like what? Yeah. And it's just, even though I know that it's good fat that I'm eating, I just don't like seeing on the app the fat being so high. And then so hopefully Barrytastic, which is a bariatric app for patients that had bariatric surgery or planning to have bariatric surgery, so you can put in your highest weight and everything and monitor your food intake and your exercise. It's a lot of stuff. It's a great app. That's just one of the issues right now with the fat and not differentiating between the fats. But yeah, so if anyone is considering or on the list for weight loss surgery, I highly suggest the Barrytastic app. I'm not sponsored at the time of this video because, you know, I don't have that many viewers and I don't have that many subscribers for me to be sponsored in the first place. But at the time of this video that I'm making and uploading, I'm not sponsored. Hopefully I am in the future. Yeah. So yeah, that's my update. 75 pounds down. It's challenging. Still dealing with GI issues, inflammation, swelling of the GI tract and everything. And yeah, it's hard to find blood on me because the amount of water I can take in. So all of these things say you should put into consideration when you are considering doing weight loss surgery. When you've tried everything else and this is your last resort, I want to give you as much detail as possible, and I encourage you to ask questions so I can explain certain things, because I don't put everything on here, but I can and will explain certain things.